Thursday. It was a full house this morning. We're joined this Tuesday. We're joined with folks from Greenwood Leflore Hospital. This morning, I've got Mr. John Cook, who's the Director of Rehab and Wellness Services over at the hospital, and Miss Lee Roach, who's the Coordinator of Cardiac Rehab. February is American Heart Month, and so it's the time that we definitely want to look at this. I want to ask you guys some questions this morning. Over at the Greenwood Leflore Hospital, you guys have what's called the Cardiac Rehab Program. Miss Lee, can you tell us what Cardiac Rehab is?
Cardiac Rehab is a program where we help patients who've had heart disorders, whether it's heart attack, heart surgery, to identify their risk factors and change the risk factors to begin to modify their lifestyle, where we educate, exercise, and counsel.
And what would, you know, when we talk about that, what would determine if somebody needs cardiac rehab?
If you've had a heart attack, if you've had open heart surgery, a stent, patients with chest pain, those are some of the predisposing diagnoses that would qualify you and get into cardiac rehab.
Now, if somebody's going to come and do a cardiac therapy session, what would that entail?
You would get an initial evaluation by cardiac rehab personnel. We are a medically supervised program where we have a physician who's our medical director, there's a nurse, exercise physiologist, and your risk factors are identified. After we identify your risk factors, we tailor a program for you to help decrease those risk factors, whether they be obesity, hypertension, diabetes, ways to change those risk factors to help you to lead a more heart-healthy lifestyle.
You know, when we talk about the heart, I mean, this isn't like one thing that's just going to affect a small population who deals with this. This is everybody.
Everybody.
How important is it for maybe somebody that's concerned to come and talk with you guys or go through a therapy session?
It's very important, especially if you've had a coronary event previously, to enroll in cardiac rehab, because it helps to decrease the likelihood of you having a recurrent event. And
if somebody was to come to this, how long would it last?
Normally, anywhere from 4 to 12 weeks, depending on how severe your condition is.
And we were talking earlier, I love the fact that we were talking earlier, a lot of times when we think cardiac rehab is the heart, you exercise it, but the other factors of things like stress, those aren't things you just work out and you're done with, right?
No, that's a lifetime. It's a lifetime of working with ways to cope with stress. One of the things that we also do is exercise, and exercise, you know, is good for stress.
Absolutely. And John, you know, you guys over at Greenwood Leflore, you have some great facilities. What all do you guys offer over there that really could help people with this?
Well, I mean, in conjunction with the cardiac rehab program, of course, we have our rehab, our physical therapy, occupational therapy, and we also have a wellness center kind of all in the same building. So, you know, we kind of work together as far as that goes. But, you know, we are definitely trying to promote this month, Cardiac Rehab Month, you know, being Heart Healthy Month. And they can locate us, you know, there at the hospital, right in front of the hospital on 1802 Strong Avenue. If they would like to look at the website, glh.org, they can find a lot of good information there about what we offer there and some of our services.
You answered all my next questions. That's what I was about to say is where can people go?
They can contact me or Lee, you know, at 459-2655 as well.
Okay, okay, fantastic. You definitely want to get in touch with these folks because it is all about staying healthy, and it's great. The resources that you guys and the services you provide really do elevate people to really have their best lives. So thanks for what you do. We appreciate it. Again, if they want to check out the website, John, where do they go?
glh.org, O-R-G, and they can you know, find all the information as far as, you know, our contact information and you know, what we have to offer there.
And you really do have state-of-the-art facilities over there.
We do. We'd like for you to come by sometime.
Definitely, no doubt. Thanks so much for being here this morning. Be sure to stay up and stay healthy. Check out the website and give them a call if you'd like. Great tips this morning. Appreciate it.
Appreciate you.
Stay with us. We've got more coming up after our break. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.